So we're going to do the joints lecture today, and evidently I was really excited about joints when I made this. You can see the exclamation point there. It's really not that exciting, but I do the best I can. Okay, so joints are actually, there's a whole chapter on different types of joints. We're going to basically hit a few high points in this lecture. We'll talk about different types of joints and also cover some examples and then what happens when things go wrong. So joints are called articulations, and this is where two or more bones meet, and they don't have to move, but many do. So if you think about like the joints in your skull, you have several bones that come together to meet at what are considered joints, but they're actually not movable, and that's good because you don't want the bones in your skull to move, because if they are moving, you've got bigger problems than just listening to this lecture. So basically, all of your joints do not have to move, but many of them do. So if you think about like your elbow joint, your hip joint, even where your jaw meets your face, that is actually going to be a joint as well. And I don't know why it always asks me this when I start this. But anyways, so the functions of joints are going to be able to, is going to give your skeleton mobility. So in other words, this is going to allow you to move your skeleton and also hold your skeleton together. So these are what are going to connect your bones together. And there's two functional classifications. So there's basically two ways that a joint can be classified. It can be classified by its function, and then also what the structures are that are present in that joint. So we'll talk about some examples first. So the first thing we're going to talk about is the functional classification. So basically this is going to be based on the amount of movement the joint allows. So there are three different types of joints that you have. Synarthroses are immovable joints, so they don't move. So you can think about those joints in between your skull bones. Amphiarthroses is going to be slightly movable joints, and then diarthroses are going to be movable joints. And so when you look on here, you'll see that this spells out the acronym SAD. So I don't know if that helps you, but SAD is going to go from least movable joints to the most movable joints. So synarthroses, amphiarthroses, and then diarthroses. So diarthroses are going to be freely movable. This would be an example of like your elbow or your hip or something like that. So these are going to be based on, the other type of classification is your structural classification, and what it's based on is what materials are binding the bones together in that joint, and also whether or not that joint has a joint cavity. So if you think about like your knee or your hip socket, there's actually like a socket that the bone sits in. And so that's what we're talking about as far as a cavity goes. Some bones and some joints don't have cavities. And so there's three structural classifications. You can have fibrous joints, cartilaginous joints, or synovial joints. So every single meetup of your bones, every single place where one bone articulates or touches another bone is going to be classified by how much it moves, which is your functional classification, SAD, and also the structural classification. So what is it made out of? So fibrous joints are going to be bones that are joined together by dense fibrous connective tissue, and these have no joint cavity. Now most of these are going to be synarthrotic, which means that they're not going to move. But this really depends on the length of the connective tissue fibers in between those two bones. Okay, that's getting on my nerves. All right, so if we look at some examples here, this is from your textbook, figure 8.1. You'll see that in between your head bones, in between your skull bones, you have joints that are held together with very short interlocking fibers. In other words, they're not going to be moving because the fibers are very, very tightly held together. So you can see here that there's not a ton of distance between these two cells, and this is also known as a suture. Okay, so when there's not very much movement, and when they're held very closely together, this is known as a suture. The other type of fibrous joint is called a syndesmosis, and this is going to be held together by a ligament. And we'll talk about the difference between ligaments and tendons in just a second. But fibrous tissue can vary in length, but it's longer than sutures. So if you think about the bones of your ankle being kind of tied together there at the bottom of your leg, these have a little bit of ability to move, but they're not going to move a ton. The other type of fibrous joint is a gomphosis. So this is like your tooth socket. So if you think about a peg and a socket fibrous joint, you have these little tiny periodontal ligaments that hold your tooth in the socket. And you can see them kind of reaching out and grabbing on to the tooth itself. And if you've ever pulled a tooth as a child, you know that when you start to wiggle the tooth, it starts kind of cracking and popping. And that's you basically popping these little bitty ligaments, which is kind of disgusting, but anyway, they pop, and that's going to allow that tooth to come out. So when I was a little kid, I had some cousins that would come over to the house to play, and one of them, my cousin and I were the same age, and so we were both losing teeth. And then I had a 4-year-old cousin that was really jealous about the fact that we were losing teeth, and so she sat in a corner and basically ripped one of her teeth out because she was so jealous of us losing teeth. And so you can pull these out even when they're not really ready by just kind of ripping all those ligaments apart. And so she was very committed to having a loose tooth. All right, so cartilaginous joints are going to be bones that are united by cartilage, so that makes sense. So these fibrous joints are, you know, held together with fibers or fibrous tissue. Cartilaginous joints are going to be held together by cartilage. They are also not going to have a joint cavity, and they're not highly movable. So there's two types that fall into this category, and you have synchondrices and symphyses. So both of these words are really kind of hard to pronounce, but synchondrices are going to be bones that are united by hyaline cartilage, and then symphyses are going to be united by fibrocartilage. And that is a typo right there. That should be a G, so fibrocartilage. Okay, so here's a couple of examples. Like I said, these are from your textbook. You can see that the bones here are synchondrices because they're going to be held together by hyaline cartilage. So you have the example is the epiphyseal plate, which we talked about as your growth plate. And then also another plate, another place that's more permanent is going to be the joint in between the rib and the sternum is connected by this cartilage. And this is immovable, okay? So, like I said, there's a structural and a functional characteristic, and so you're seeing that here. The next one is a symphyses, or a symphysis is the singular word. So these are bones that are united by fibrocartilage. Two places on here is going to be in between your vertebra. You have this little disc that's in between there. So if you've ever heard of like a ruptured disc or a herniated disc, that's what these are. So these are discs that are kind of sandwiched between hyaline cartilage, and they're sitting in between your vertebrae. You also have one in between your pubic bones at the very front of your pubic area. So this is going to be your pubic bones, and they are actually held together by this pubic symphysis. And in females during childbirth, this kind of spreads a little bit to allow for the passage of the fetus through the birth canal. So synovial joints are your last category, and these are going to be separated by fluid-filled joint cavities. So synovial joints are the only ones that actually have a joint cavity. And all of these are diarthrotic, which means that they're very freely movable. And so this is what you really think about when you think about a joint, are these synovial joints. And these are going to include all your limb joints. Most of the joints of the body fall into this category. So if you think about moving your fingers, you're able to move those around. You know, you probably hear me popping my fingers right now. I'm popping the synovial joint. And basically what that is like air caught in that fluid, and then you move your fingers around to release the air. So let's look at some examples and characteristics of synovial joints. So for the next few slides, really what we're going to be doing is we're going to be going over specific things about synovial joints. So up to this point, we've discussed the classification systems for joints. So we have either functional, or structural characteristics. And then we've talked about a few examples of those type, but the major part of the joints chapter is focused on telling you about synovial joints and the characteristics of it. And that's because this is the main kind of the one that's most common in your body is the synovial joint. So there's there are a ton of different characteristics about them, and so these are 6 different distinguishing features that are specific to synovial joints. So for the rest of the time that we're talking about joints, we're going to be talking about synovial joints and things that make them kind of special as compared to the other joints in your body. So the first thing is that they have articular cartilage. So if you remember back at the beginning of this lecture, I said articulations are where 2 joints or 2 bones come together. So articulations are where 2 bones come together, and articular cartilage is going to be on the ends of your bones. And so if you think about, like, if you've ever eaten chicken wings, when you get the little wingy parts, you know, if you bite the end of it, it kind of is rubbery or bouncy, and that's that articular cartilage covering the end of that bone. If you think about a drumstick, that drumstick is a leg, and that hip joint where the leg would have connected is going to be covered in this cartilage, and it makes the bone kind of rubbery on the end. So if you've ever been eating hot wings and you kind of bit into something that was real rubbery, that's probably most likely this articular cartilage, which is made out of hyaline cartilage. And this is going to prevent the crushing of bone ends, which is very important, like especially in people when we walk upright. The hip joint is covered in this to kind of keep you from grinding bone on bone. Okay, and then the next thing is a joint or synovial cavity, and this is a small fluid-filled space. The joint also has an articular joint capsule, which will have 2 layers, an external fibrous layer and an internal synovial membrane, which is going to actually make the synovial fluid. So inside this joint cavity, you do have fluid that's in there, and it looks kind of like egg white. It's very slimy. So the synovial fluid is this viscous, slippery filtrate. It has plasma and hyaluronic acid in it, and what it's going to do is lubricate and nourish that cartilage that's covering the ends of the bones. And it also contains phagocytic cells, which remove microbes and debris. So basically it has kind of a cleanup crew within there. And if you've ever and this fluid, it looks just like egg white, and it's very slippery. All right, so, and that's good because it's going to be in here, and it's going to allow these bones to kind of slip past each other. So if you look at this picture, you'll see on here that you have a ligament kind of going around the edge. And I said that I would tell you what ligament and tendons are, and I forgot. So a ligament is going to actually be a bone-to-bone connection. So you can see here that this bone here is connected to this bone here. So a ligament is a bone-to-bone connection, and then a tendon is going to be a muscle-to-bone connection. So we'll look at that in just a second. So here is your joint cavity. You can see that it has this fibrous layer on the outside. It has this synovial membrane here. And then in the middle you have this synovial fluid. Okay, so this is the joint cavity, and then you have these supporting ligaments that kind of wrap around them. So it also has different types of reinforcing ligaments. There's capsular, which is going to be the thickened part of the fibrous layer, extracapsular, which is outside the capsule, and intracapsular. So this is going to be deep to the capsule and covered by the synovial membrane. So if we look back here, this you can see the articular capsule is going to be kind of this outer area here. Also within synovial joints, you have nerves and blood vessels. The nerves are going to actually detect pain, so and monitor joint position as stretch. So you've probably all experienced some sort of hyperextension before, like if you push your fingers back too far, or maybe you're playing a ball and you know you fall weird on your leg and it kind of hyperextends your knee or your elbow. So that just means it bends too far back. And so the nerves are going to kind of tell you, hey, we need to stop moving in that direction because we're going to hurt something. Capillary beds will also exist in this area, and that's going to provide that fluid for the synovial fluid. So other areas within that synovial joint will have fat pads. This is going to be for cushioning between the fibrous layer and the synovial membrane or bone. And also there are articular disc or menisci, and these are going to basically stabilize the joint, improve fit of the bone ends, and reduce wear and tear. So you may have heard of like a torn meniscus before, and that's basically these little discs that are sitting in the middle of the joint. And we'll look at a picture of these in just a second. So another characteristic is bursa, and these are sacs that are lined with synovial fluid, and basically these are going to allow the bones to kind of rub or roll across each other without scratching or tearing up ligaments and muscles. Okay, so if you've ever heard of bursitis before, that's basically an inflammation of the bursa, which will be pretty painful, and especially when you move the muscles in that area. Tendon sheaths are going to be elongated bursa, and they wrap around the tendon subjected to tension. So remember I said a tendon is a muscle to bone connection. So you can see here, this is the tendon of the biceps brachii muscle, which is like your bicep muscle, and it reaches up and it wraps around the shoulder and kind of attaches back in here. Okay, and so around that tendon you have this tendon sheath, so that when this muscle pulls, this tendon isn't rubbing on your humerus, which is very helpful, because if it does, then that becomes very painful. Up under here, which is under the scapula, so between your shoulder blade and your arm bone, your humerus, you have another subacromial bursa. So these are kind of just rolling sacs to help reduce the tension. You also see another synovial membrane here, articular cartilage covering the ends of the bones, and the joint cavity containing the fluid there. So this is just an example of how the bursa is going to lessen friction. So you can imagine if you roll your arm this way, this little bursa is going to kind of roll around in there to help reduce the friction of this tendon with this bone. Okay, so there are these these bones are connected to each other, but you don't want them to kind of like slip out of place or move incorrectly. And so there are stabilizing factors that help to hold the bone in place. There are three things that are important. One of them is most important, but the shapes of the bones themselves will actually allow for a good fit or not a good fit of the bones. Sometimes babies that are born may have some problems with their hip sockets not being completely formed around their heads of their humerus, and they may have, not humerus, but femur. They may have to wear like a leg brace to allow the bones to kind of better fit each other for a while, and so to prevent them from popping out of socket. So the ligament number and location is another one. This has a limited role, but the most important thing that stabilizes your joints is your muscles, tendons crossing the joint. So remember, ligaments are bone-to-bone connections and tendons are muscle-to-bone connections, and so these muscles reach out and kind of wrap around the joint with their tendons, and this is going to help keep the tendons taut by keeping the muscles toned up. So basically, if you've ever had a joint problem before, chances are you've probably been to physical therapy to help with that. And that's because you want to exercise those muscles that are surrounding the joint to help keep the tendons in good shape, so that your knees and arches of your foot, shoulder, hip, all those things are functioning as they should be. Okay, so all muscles are going to attach to a bone or connective tissue at 2 points, at least. And we'll go over this in more detail when we actually get into the muscle unit. But the origin of a muscle is going to be an attachment to an immovable bone. Okay, where as the insertion would be an attachment to the movable bone. So let me turn on my camera here for a second and see if I can show you what. Okay, here I am. Hey guys. All right, so if you're thinking about the origin and insertion, if you think about your bicep muscle here, okay, when you think about the bicep, it has two attachments. It's going to attach in your elbow, and it also wraps around your body and kind of attaches back here in the shoulder joint. Okay, so you have an origin and an insertion. So the origin is going to be the less movable joint or bone when you flex your muscle. So when you flex your bicep, your shoulder is not really moving. So that's going to be the origin. whenever you move your arm, whenever you flex your bicep, the movable bone is down here. Okay, so basically the immovable is going to be up here, which is the origin. It wraps around and attaches down here in your elbow, which is going to be the insertion. And so we'll talk more in detail about that when we get actually into the muscle unit, but I just kind of wanted to highlight that now. So muscle contraction will cause the insertion to move towards the origin. So think about what I just said. When you contract your bicep, it's going to pull your forearm closer to your shoulder, and so that's going to be the insertion, whereas your shoulder is kind of stable, and that will be the origin. Okay, and there are lots of different places where the movements can occur, and it just really depends on the joint. Okay, so speaking of moving joints, the synovial joints actually have several different classifications as far as their range of motion goes. So if it is non-axial, that means it's going to be slipping movements only. Uniaxial means movement in one plane. Biaxial means movement in two planes. And multiaxial means movement in or around all three planes. So we'll kind of look at what that means in just a second. So there are three general types of movements at synovial joints. There's gliding, angular movements, and rotation. Now, in your textbook in this chapter, it's going to go into detail about all these different motions. Due to the fact that we've already really covered this in the Intro to Anatomy section, I'm not going to go back over this, okay? So flexion, extension, hyperextension, abduction, adduction, circumduction, rotation. You should know what all those are already due to the fact that we covered it in the medical terminology unit, or in the medical terminology lecture. So that is in your textbook, but I'm not going to really go into that right now because we've already covered it. Okay, so this is basically a kind of an example or a summary chart of everything that I've said up to this point. Bone, so you've got the fibrous, cartilaginous, and synovial structural classifications. And then you also have down here on this end the functional classifications. So is it movable or not? And then lots of different information in here as well. So sutures, syndesmoses, gomphoses, we've already talked about those. Synchondroses, symphysis, we've already talked about those. And then now what we're going to do is look at several different examples of synovial joints and how their movement moves, whether or not it's uniaxial, multiaxial, and the type of motion that's involved. So like I said, there are several different ways that these can move, and they're classified based on the shape of the articular surfaces. So plane, hinge, pivot, condylar, saddle, and ball and socket. So let's look at what these mean. So this is the grand scheme of all the different joints shown here, all the different synovial joints. So what we're going to do is just take a minute and kind of go through these and look at examples. So the first one is the plane joint, and these are going to be in the carpals. So this is your hand here. This would be the thumb sticking out this way with your fingers kind of poking up into this area. This would be the middle of your hand. So the bones in between of your wrist are called the carpals, and they're going to have this gliding motion. So it's non-axial, so it's not actually bending or rotating or anything. It's just kind of sliding back and forth across each other, and that's what this is showing, is this gliding motion here. Some people can pop this joint by pushing down on the thumb and pop the joint here in between their wrist joints. Another type of synovial joint is called the hinge. Some examples would be your elbow. So think about your elbow being like a hinge. You're going to straighten it out to 180, bend it back. This is going to allow for flexion and extension, which is a uniaxial movement, so one direction. Okay, it's moving in one direction. And here's an example here. This is your elbow. This is your humerus and your ulna. Another type is a pivot joint, and it also has a uniaxial movement, but it's going to rotate. Okay, so the two bones in your arm, the ulna and the radius, are connected to each other with this little sleeve that's kind of sticking around here. Okay, and in between it, you can imagine your kind of this bone being an axle, and then a sleeve, which is the ligament around here. And so this kind of twists around, for an example, like doing the wave like this, okay? So that's going to allow for that twisting motion to happen. Where's my camera? There it is. Okay, so twisting like this would be an example of that, of the pivot joint, okay? Condylar joint is going to be kind of movement in a biaxial, which means it can move in two directions. So if you think about your finger, you can move it front and back and then side to side. Okay, so let's show you an example of that. So you've got front, back, and then side to side, side to side, side to side. Isn't this exciting? Just so many joints. Okay. All right, so biaxial movement, side to side, front to back. And you can see here that it looks kind of like a crucible, mortar and pestle. You've got an oval articular surfaces. Saddle joint is the next one. It has biaxial movement, so it can move in two directions, adduction and abduction, and then flexion and extension. So your thumb can kind of go side to side and then backwards and forwards as well. And that's what this is showing here. So the difference between this one and the previous one is this has an oval surface and this really has like a C shape. Next up is ball and socket, and this is the one that people are most commonly thinking of when you think of a joint. And this is going to have a cup or a socket and then this head or the ball that kind of fits in that. And it has a multi-axial movement, which means it can move whichever way, okay? So it's freely movable. Your shoulder is actually the most movable joint in your body. Second is the hip. So in this, I wanted to show you an example of different things going on. So this is kind of the summary of everything is the knee joint. You can see that it has all the different characteristics that we talked about as far as the synovial joint. You can also see that there's the patella kind of sticking out here and sheathed in, in tendons. Okay, so it's a sesamoid bone. You can see this bursa in here. You can see the menisci. You can see the ligaments kind of sticking across there. So it's very complex. And actually, this is going to make your knee the most susceptible to like sports injuries, is because so many things can go wrong. Okay. So let's talk about what can go wrong. So first of all, you can have a cartilage tear, and this can be due to compression or shear stress, and basically fragments can make like break off and cause the joint to lock up or bind up. So if you've ever heard of somebody saying like their back's locked up or their hips locked up or something like that, that can be due to the cartilage tearing. It's usually going to be repaired with arthroscopic surgery, so like a little tiny surgery to go in there and fix the ligaments or cartilage. Partial menisci removal can happen, and this is actually going to render the joint less stable, but it's still movable. So if you completely remove those menisci or meniscus, that's going to lead to osteoarthritis. So basically those bones are going to then be rubbing on each other, which is very painful. You can actually get a meniscal transplant in younger patients, and there's potential in the future that menisci can actually be grown from your own stem cells. So that's pretty exciting. So here's a tear in the meniscus. This is the femur and the tibia. So this would be in the knee, and you can see a torn meniscus here. So you could either go in there and take out the whole thing or kind of just cut out this area. Another injury is a sprain. And the ligaments that reinforce a joint are torn or stretched, and these are going to heal very slowly. So most athletes would prefer a break over a sprain, and that's because these sprains are made of cartilage or ligaments, and so it takes a long time to heal because they don't have a ton of blood flow. Okay, so if you think about cartilage being torn. There's not a ton of blood vessels feeding that, so it takes a long time to heal it. 3 options: if torn completely, you can sew the ends back together, you can replace it with grafts, or you can just wait. Okay, put on a brace and hope for the best. Dislocations are called luxations, and this is when your bones are forced out of alignment. It's usually going to be accompanied by other injuries, so like a sprain or difficulty moving the joint. Serious falls or contact sports can cause this. So my brother dislocated his thumb playing football, and then he tortured me throughout our childhood by taking his thumb out of socket and then like touching me with it. I don't know. It was weird. So anyway, he would like wave it in my face after he had pulled it out of socket, and it's just disgusting. So anyways, it must be reduced to treat, which means that you have to quit moving it. Subluxation is going to be a partial dislocation of a joint. All right, so bursitis is going to be inflammation of a bursa. This is usually caused by blow or friction. So basically overuse. Also, if you are injured, like say in a car accident, that's what it means by a blow. So being hit or friction. If it's treated with rest and ice, and if it's severe, you can take anti-inflammatory drugs for it. The same thing with tendinitis. If you've ever heard of like carpal tunnel or maybe some sort of like piriformitis, these are going to happen due to kind of overuse, and same treatment for that. And a lot of times physical therapy will be used for this as well. So arthritis is very a complex disease. It's actually over 100 diseases can be classified as arthritis. It's the most widespread crippling disease in the United States. Symptoms include pain, stiffness, swelling of the joint. Acute forms can be caused by bacteria, which we'll talk about in a minute. And this is actually very applicable to the South because we are outside a lot, and we'll talk about why in just a second. And it's treated with antibiotics. Chronic forms of arthritis are going to be like osteoarthritis and rheumatoid and gouty arthritis. So here's an example of a hand that has a patient that has rheumatoid arthritis. This happens a lot of times in elderly people, and you'll see like my grandmother has some twisting of her fingers on the end, not this severe, but just kind of in these joints down here where arthritis has kind of damaged the joints. So I was talking about bacteria causing arthritis, and this is usually caused by Lyme disease, which is picked up from ticks. Okay, so this is super applicable in the South because we are in the middle of dove hunting, fishing, turkey hunting. Well, not turkey hunting, but excuse me. Okay, so excuse me, I had a small coughing issue there. All right, so it's going to be caused by bacteria transmitted by tick bites, and this is very common due to the fact that people are outside a lot at this time of the year. Symptoms may include skin rash, flu-like thinking, and foggy thinking. It can lead to joint pain and arthritis, and really you just treat it with a long course of antibiotics. So the way you can tell that if you have Lyme disease is through the, there is a way to tell, and it's because the bite looks like a bullseye. So I'll show you an example here. So you can see that the tick actually bit in the middle, and then it comes up with this like rash around it, this ring. So that's a sign that you have been infected with Lyme disease. So that is all for this lecture, and make sure that you do the learning model